Good evening, everybody. Welcome to our back pain seminar. My name is Elise Hilskamp, and on behalf of Premier Physician Network and Premier Health Spine Specialists, I'd like to thank each of you for attending this evening. We are so glad to have you with us. Tonight, we are here to discuss back pain. As you may know, back pain is a very common issue for many. You are not alone. The good news is that there are options available to help reduce pain, increase mobility, and get you back to the activities that you love. Our physician expert, Dr. Daniel Quinones, will give a brief presentation this evening on those options. He will also answer some of your questions following his presentation. To submit a question, click the Q&A button that should appear by hovering your cursor over the bottom of the Zoom screen, and that is where you can type in your question this evening. You may send in your questions at any time during the presentation, but we will wait until the end of the presentation to ask all the questions. You may also see a chat button near this at the bottom of your screen near the Q&A button, but please disregard that and send all of your questions through the Q&A button this evening. We will try to get to as many of them as possible tonight. Also, this seminar will be recorded. You will receive a link to the recording via email in the next few days should you want to go back and reference any portion of this evening's presentation. So without further ado, let's introduce our speaker this evening. Daniel J. Quinones, MD, graduated from Jefferson Medical College of Thomas Jefferson University in Philadelphia, Pennsylvania. He completed his orthopedic surgery residency at University Hospitals Cleveland Medical Center, Case Western Reserve University in Cleveland, Ohio, and a spine surgery fellowship from Washington University School of Medicine, Barnes Jewish Hospital in St. Louis, Missouri. Dr. Quinones sees patients at his offices at Miami Valley Hospital North, and Upper Valley Medical Center. Dr. Quinones practices at Premier Orthopedics. He is also part of the Premier Health Spine team. Premier Health Spine takes the pain out of finding a back and neck specialist. With one phone call, you'll be connected to the right specialist for you from our team of orthopedic surgeons, neurosurgeons, pain management specialists, and physical medicine and rehabilitation specialists. Thank you, Dr. Quinones, for being with us this evening, and I will turn the presentation over to you.
Thanks, Elise. Good evening, everyone. We're going to be talking about back pain today, or at least that's what the presentation is about. But you know, when the questions pop up at the end, feel free to ask anything spine related, and we'll try to cover as much information as we can today. It's a really broad topic. I tried to cover some of the main points, but I have no doubt that I'm going to miss something that might interest you, so please ask about it during the Q&A session. I'll try to keep the presentation kind of short so we can get to what you really want to hear about. But my name is Dan Quinones, and here we go. Let's advance the slide. So low back pain is extremely common. I see patients in clinic with that complaint. Probably 60 to 70% of the patients that come see me have some sort of low back pain. And it's reflected in the population. 80% of anybody you ask is going to have reported back pain at some point in their life. And if you ask them how much back pain, or have you had back pain in the last 3 months, 1 in 4 people that you ask are going to say they had low back pain in the last 3 months. So it's incredibly common in our population. It's actually the second most common reason to see a doctor, the most common being an upper respiratory infection. But back pain can be quite a burden on the individual. It's even a burden on the entire economy. In the United States, you know, $100 to $200 billion are spent a year or lost a year because of low back pain. Patients are often out of work or not being as productive as they usually are. And so there is a significant impact. And so it is something that has been studied a lot. Now, having so many people in our country with back pain, if you think you would see nobody on the streets, nobody walking around, everybody's at home writhing in pain, but most patients get better. It's actually incredibly common that the back pain just goes away, even if you don't do anything. 60% of patients are gonna, have a resolution of their back pain in less than a month, and the vast majority are gonna have resolution of their back pain within 3 months. So although it's extremely, it can be extremely painful and debilitating, just take heart that chances are it's going to go away, and you'll be able to get back to normal. Some of the serious causes of low back pain, and by serious, I mean like scary things like cancer, they're extremely uncommon. So definitely a zebra not a horse, if you know the reference that I'm speaking to. Now, the question is, if my pain is going to go away in 3 months, do I even need to call a doctor? And there are some instances where you should. If the pain is present for more than a few weeks, why continue to suffer on your own? Reach out to us, especially here at the Premier Health Spine Center. We can take care of you. So if your pain doesn't go away in a few weeks, give us a call. If you have any other symptoms associated with your low back pain, so if there's any weakness or numbness or tingling in your legs, that can be a sign of a pinched nerve, and we may have other treatments specific to nerve impingement. If there's an unexplained weight loss accompanied with your back pain, that means like if you've lost 20 pounds in the last month and you're eating the same amount of ho-hos and ding-dongs that you usually do, we should know about that. There are some nefarious causes of weight loss that may warrant further workup. So give us a call if that's the case too. If there are any new bowel or bladder problems, so when I say bladder problems, I mean where you might urinate on yourself and you don't even feel it. That can be that can actually be an emergent situation called cauda equina syndrome, where if you call up, we're going to tell you to go to the emergency room. If there's a fever associated with your back pain, so you've been sick and had severe back pain and they go together, that can be a concern for, or at least a warrant further workup. Because these are kind of important, so I'll just mention this real quick. I'm sorry if this is repetitive. So when you come to a physician, it's our job to identify red flags. Red flags meaning potential signs or symptoms or something in the history that would lead us to suspect something more nefarious than the typical causes of back pain. So some of the atypical causes of back pain include infection. So you can get an infection in your spine. So if you have a history of IV drug use or an immunodeficiency disorder, or some other reason for us to suspect infection, such as fevers or chills, then we may do a further workup to rule that out. If you have a history of cancer and there are some atypical aspects to the history or your complaints, then we may need to investigate further to rule out cancer as a cause. Keep in mind that cancer is a very rare cause of back pain, but in patients with a history of cancer, the risk of cancer-related back pain is obviously increased. If you were in a trauma, so if you fell down the stairs, or you just tripped and fell, or you were in a car accident and you developed sudden back pain, you could have fractured your spine. So we may do more advanced imaging to look for that. If you, some red flags for an emergent cause of back pain, such as cauda-equina syndrome, you might complain of urinary incontinence, where you pee on yourself and you didn't even feel it. So if that's the case, that can be very alarming, and we'll investigate further and expeditiously. So who is at risk for back pain or low back pain? With back pain being so prevalent in the population, you can imagine that the risk factors are quite broad. One identified risk factor is gender. So men tend to get back pain more often than women. My wife would say it's probably because we are weaker than women. So that is always possible. Patients with mental health disorders such as anxiety or depression, they experience pain differently than someone who doesn't have one of those conditions. So if I hit my thumb with a hammer, I would say, ouch, that hurt. Someone who has a higher level of anxiety, they may say, ouch, that hurt. Now my finger is going to fall off. I'm going to lose my job. I'm going to be on the streets, and it can snowball. So they experience pain differently. So mental health disorders can contribute to back pain. Patients with a family history of back pain, that can be because of osteoarthritis, which has a genetic component. There are some genetic inflammatory conditions of the spine. So patients with a family history are at an elevated risk of back pain. Patients with a structural problem to their spine, such as scoliosis or other malalignment conditions, which we'll talk about, are at risk for back pain. Patients with certain occupation types, patients who lift a lot, work in a factory and do repetitive motions that require a lot of, that put a lot of pressure on the spine. Patients who operate jackhammers or truck drivers, they deal with vibrations. Myself, as a spine surgeon, I lean over an operating room table for up to 12 to 14 hours a day. That can be extremely taxing, and I've had back pain in my life as well that got better with some of the treatments we'll talk about. The older you are, the more degenerative changes you can accumulate, and so the older you are, the higher the risk for back pain. If you are overweight, excess weight puts additional pressure on the discs, the joints. It forces your muscles to work harder, and so being overweight can be a significant cause of back pain and a modifiable risk factor for back pain. Patients who just live a sedentary lifestyle, you get back pain. It's a use it or lose it kind of thing. Your muscles weaken, your joints stiffen, you're not as flexible, so your overall functional ability can contribute to back pain. Smoking or nicotine use, whether that's smoking or vaping or chewing, any sort of nicotine use actually puts you at an increased risk for back pain. The nicotine constricts the small blood vessels in your body, and that includes the ones that go to your spine. And so you could be choking off the blood supply to your spine, which can be painful. So there are a lot of risk factors for back pain. And if you live on Earth, you're at risk for back pain. Now, what are some of the symptoms, right? It's not just every patient doesn't present the same way. You may hear some noises. I have patients who have clicks and pops and not just in their back, but other joints too. And that is typically a result of unsmooth surfaces rubbing against each other. So as the cartilage in the joints of the spine develop potholes, basically, as they degenerate. They're no longer smooth. And so if you rub two unsmooth surfaces together, you can make noise. So you might have clicks and pops that are associated with your back pain. Stiffness. Patients with back pain get stiff. When the body develops inflammation, stiffness comes along with it. So patients who have knee or hip arthritis, they know exactly what I'm talking about. When you have knee pain and your knee is swollen, your knee becomes stiff, and the same thing happens with your back. Postural problems. Patients who have low back pain, they try to assume positions that cause them less back pain. So you may find them leaning on objects when they're standing. So if you're at the grocery store, you might find a shopping cart and lean on the shopping cart, because then your spinal muscles don't have to work as hard, or you've managed to take some pressure off the joints in the back of the spine. So patients with back pain may complain of muscle spasm. They may feel a knot in the low back muscles. And they can have achy pain, they can have sharp pain, they can have burning pain, all different presentations of low back pain. They might have some positions that make their pain worse. They may have some that make it better. As a physician, those can give us information as to what's causing your back pain. So we'll ask, and it'll help us figure out what's going on. We'll ask things like, how often do you get the pain? Is it all the time? Is it only with certain activities? Is it at night? While, when you're at night laying down, you're not that active, your back pain may be relieved, or it can be worse because you have nothing else to think about. So the time of day can change your back pain. Some back pain is associated with leg pain, where if the nerve is being pinched in your back, it can shoot pain down your legs. And people often refer that to, they call it sciatica, which is nerve pain from a pinched nerve, nerve pain in the leg from a pinched nerve in the spine. You can actually have pain in your hips and your butt and your thighs just from trying to stand up straight. So if you have a spinal deformity, or you walk bent forward for other reasons, occupation, or I stand, bent forward for hours a day, you can get pain in your hamstrings, your glutes, your quads, your hip flexors. So you can get pain in the legs from back pain, essentially from malalignment. So let's go on. There are a lot of different causes for back pain, and most often they're benign, but as a physician, we try to figure out why you're having back pain. Oftentimes it's multifactorial. It's not one single thing, but it's our job to figure it out. And one very common cause of low back pain is arthritis in the spine. So there are different types of arthritis. There's the most common, which is the wear and tear arthritis. That's called osteoarthritis. It's the same arthritis you get in your hips and your knees and your hands and your feet. Any joint in your spine can degenerate, and that's what arthritis is, or osteoarthritis. And that can happen in the spine, and that can cause pain. It's wear and tear of the cartilage in the joints of the spine specifically, or the disc itself can degenerate, and that's what osteoarthritis looks like in the spine. Here's a little picture where if you can get degeneration of the disc, which can cause back pain. You can get degeneration in the facet joints. These are joints located in the back of the spine. the two joints move, all joints move. And if those joints are not smooth, if they have potholes from degeneration, if they're bumpy surfaces, two bumpy surfaces rubbing together, can stir up inflammation, and that is painful. So spine arthritis can cause back pain. Other causes of back pain include a bulging disc. So the disc is it has two components, and it has a tough, fibrous outer ring, and then the center is filled with like a jelly. And as you age, the disc can dry out, where the inside is no longer as squishy and jelly as it used to, and the outer ring can become lax or loose, and it bulges. So it's no longer able to maintain its shape, and with pressure, it can't go up or down because the bones are there, so it bulges out. And the outer ring has nerve fibers in it, and so you can have back pain from bulging of the disc. The bulging is just a sign of aging. It's a degenerative change in the disc. It's not necessarily the cause of pain, even if we see it on an MRI, but it can be a cause of pain. It's the cushion between the bones, and over time it loses its hydration, and you can't really stop that. There's a lot of research out there to try and slow it down or stop it, such as stem cell replacement or certain supplements like chondroitin, glucosamine chondroitin. Some people say that can hydrate cartilage. I can't speak to the effectiveness of that, but one problem with your spine is it essentially dries out, the disc specifically. Other causes of back pain, one can be a disc herniation. So the disc has that jelly center, that gelatinous center, and it can pinch a nerve and cause leg pain. And oftentimes there is back pain associated with the leg pain. So if we cut the spine transversely, basically like this in this plane, this is what it's going to look like. And if you look at that blue little ring, that's the outer ring of the disc, called the annulus, and then the pink area is the jelly center, the nucleus pulposus. And as the ring becomes incompetent with age, drying out, it can get tears. You can actually squirt the jelly out, basically herniate the jelly into a nerve root and cause leg pain. And that can cause back pain too. So disc herniation is a possible cause of back pain. Other causes, and the back is not just the spine. The majority of your back is muscle. There's muscle, there's tendon. When I have patients who complain of pain in their low back, and there's some in the middle, but it radiates to the sides. That pain radiating to the side or of midline, there's a lot of muscle there, and you can certainly get back pain from a problem in the muscle. It's actually much more common. I see plenty of patients who have a perfectly normal appearing spine or mild degenerative changes, and they have severe back pain, and their muscles are spasming. They could have strained a ligament or had a little tear in one of the muscles, and those are exquisitely painful. They can ache, they can be sharp, they can radiate. It can be hard to stand. You can have trouble sitting. You can have, different positional problems, and it's from the muscle itself. It's not the actual spine. So the muscles and ligaments can be strained or injured and cause back pain. Other causes of back pain is one other one is sacroiliac joint pain. So the sacroiliac joint is where the spine meets the pelvis, and you can get pain there. It's a joint. It doesn't move too much, but there is some small motion. And anytime there's motion in an abnormal joint, you can have pain. You can stir up inflammation. Even if it doesn't look bad on an X-ray or an MRI, you can still have pain at the SI joint. Typically, this pain is off midline. If it's low back pain, that's just off to the midline. Some patients have little dimples near that area where the SI joint is. So if you have pain there, patients will often point right to the spot that hurts them, and they're pointing to their SI joint. So SI joint pain can be a cause of low back pain. So it's something that we look for because it's treated differently, slightly, or at least we can try different things. Another cause of low back pain can be malalignment. So scoliosis is an abnormal curvature of the spine if I'm looking straight at you. So if I'm looking straight at you, the spine should be nice and straight. An abnormal curvature when I look straight at you is called scoliosis, and you can have it as a kid and have no problems until later in life when you start accumulating degenerative changes. You can have no scoliosis as a kid, and because of the discs wearing out asymmetrically, it can start tilting your spine off to the side, and your spine is always going to try and curve back to being balanced. So you can develop a degenerative scoliosis due to asymmetric wear of the discs. Scoliosis in itself is often not painful. So just having scoliosis doesn't mean you're going to have back pain, and it doesn't mean that that is the only source of your back pain if there are other reasons to have back pain, even in the setting of scoliosis. Another type of malalignment is called kyphosis. So kyphosis is normal. Your spine should be curved forward in the thoracic spine. That is normal. An abnormal or excessive curvature of the thoracic spine, such as the one in this picture, this can be pathologic. There are conditions that are where this is the only problem. That's called Sherman's kyphosis. You can have it as a kid or an adolescent or an adult, or you can develop it from repeated compression fractures, just a gradual wedging of your thoracic vertebrae. All of those can cause hyperkyphosis, or an abnormal amount of curvature in the thoracic spine. Another form of malalignment is at the segmental level, where a vertebrae that should normally be aligned with another vertebrae shifts forward. That's called a spondylolisthesis. And that shift is often a degenerative change. The disc is no longer able to hold things in line, and gradually over time, the bone starts to shift. And it can be from a variety of causes. It can just happen over time from the disc wearing out. You could have had multiple stress fractures as a kid or an adolescent, and it never healed in the back. And so you can start to develop a shift over time. So a variety of reasons, but if you see it, it's a degenerative change often, and we have to figure out whether or not it's a cause of your back pain. Other causes of back pain one that I see very, very often is a compression fracture. So a compression fracture is a failure of the vertebral body, which is the rectangular portion in the front. And a lot of your weight and body weight and gravity is transmitted through the front of the spine, especially in the thoracic spine. the majority of the pressure is in the front of the spine. So if the bone is not able to withstand the pressures, it can break or it can compress where the bone is too weak to support whatever force was applied on it. Now, if the bone is really weak, you can get a compression fracture from sneezing or falling, just trip and fall. When you're landing on your butt, you can get a compression fracture. You can get compression fractures from higher energy mechanisms or injuries, such as like a car accident or a fall off, a 2-story building. You can get a compression fracture, but most often it's a compression fracture due to weak bone. And typically that's because of osteoporosis. Osteoporosis is a weakening of the bone because the bone density is diminishing and your body doesn't have as much mineral in the bone. Over time, as we age, we start to leach some of those minerals from our spine, and the bone can become weak. So the patients who are at the greatest risk for osteoporosis are older. The older you are, the higher the risk. Postmenopausal females are at the highest risk. So the lack of estrogen in the postmenopausal state increases the leaching of the bone. And so if you're a postmenopausal woman, you should be absolutely trying to maintain your bone density. So calcium and vitamin D supplementation. If you're diagnosed with osteoporosis, then your primary care physician may put you on a medication to try and boost the density of your bone and prevent these compression fractures. These compression fractures are preventable. They're fragility fractures. They're a weakness of the bone. So we can boost the strength of the bone. If you come to me with acute back pain after a fall on the ground and you're 60s, 70s, 80-year-old, I'm going to be concerned about a fracture and want to get an x-ray of that area. A much less common cause of back pain is ankylosing spondylitis. This is an inflammatory condition, such as like rheumatoid arthritis or lupus. This is an inflammation within the spinal structures that leads to calcification of the ligaments. So you can see in this this spine on the x-ray that the front of the spine looks like it's connected. And that is the bridging calcification across the spinal segments. And you can imagine that that will cause stiffness or pain. And you actually you can see it much earlier in life. And at the most common population that presents with ankylosing spondylitis is actually young men less than 30 years old. Far different group from the older postmenopausal women who might have a compression fracture. This condition is much rarer and presents in a very different population. Those patients often complain of significant stiffness, especially in the morning, and then that gradually improves with activity, but their range of motion can be severely limited, determined by how much of their spine has fused itself. But a very rare cause, and typically we can see it on an x-ray, so we can diagnose it relatively quickly. There are lots of causes of back pain, and a lot of the back is not the spine, and so you can get referred pain to the back from sources outside the spine. So you can have hip arthritis that presents as low back pain. Often it's on the side of the affected hip. It can be upper buttock pain. It can radiate up the back from the hip. So you could have hip arthritis. So I check the range of motion of my patient's hips and assess for pain in their hip joints if they're complaining of back pain. A less common condition, something called piriformis syndrome. This is the piriformis is a muscle deep within the buttocks, and it can be tight and cause low back or upper buttock pain. It can pinch the sciatic nerve and cause leg pain. So it's on the differential for back and leg pain. You can have a kidney stone that can cause back pain. The problem is not in your back, but it presents as back pain. So, there are other reasons besides your spine to have back pain. And so with so many reasons to have back pain, how on earth do we figure out what's causing the back pain? And the most useful tool, especially initially when you come see us, is we talk to you. We get a history. We find out when did the pain start? How long has it been going on? Is it constant? Does it come and go? Does it come with certain activities? Does it go away with certain activities? Does it travel anywhere? Does it go down your leg? Did it happen because you fell off, a step ladder? There's parts of the history that are going to help us find out why you're having back pain. The other parts of diagnosing your back pain is we're going to do a physical exam. We're going to touch you. We're going to find out where it's tender. We're going to bend you. We're going to put some pressure on your spine. We're going to stand you up. We're going to sit you down. We're going to help. The physical exam is going to help us determine where your pain is. There are specific physical exam maneuvers that we do to test your SI joint, to test your hip joint, to try and figure out where your pain is coming from. So the physical exam is also extremely important. We're going to test your strength in your legs. We're going to test your sensation in your legs. We're going to test reflexes to make sure there's no neurologic component to your back pain. And we're going to get imaging. If you have back pain and you come see me in clinic, I'm going to have an x-ray. Not everybody really needs an x-ray, but I gain so much information from just a regular x-ray that chances are if you see me, I'm going to get an x-ray. But there are a variety of imaging modalities that we use to try and find the diagnosis. X-rays, CT scans, MRIs, EMGs or nerve conduction studies. We put little electrodes in your muscles and we see what the nerves are doing. Typically done by a neurologist or a physical medicine rehab, not by the spine surgeon, but I will order it if I think it is useful in helping with the diagnosis. Often you don't need it for low back pain though. So not everybody who comes to see me with low back pain is going to get an EMG, very rarely. So the diagnosis is not necessarily easy, and it may not be completed in our first visit together. I may need to try some sort of treatment to help rule out a cause of back pain. Or we may not know exactly if it's the muscle or the bone or the arthritis. We may not know the exact cause of the back pain before we start treating you and trying to make you better. Sometimes just treating may make you better, and we may never truly know why you're having the back pain. It may be multifactorial. You may have multiple reasons for back pain. So the diagnosis of low back pain can actually be really complicated and difficult and frustrating for both the patient and the physician. And so like I mentioned, I get a lot of information from an x-ray. I have plenty of patients who come back to me or come see me with an MRI or a CT scan, but don't be surprised if myself or any physician that you see wants an x-ray. It's not as fancy as an MRI. It's not as detailed as a CT scan. but you get a lot of useful information about alignment, bone quality, and it's a quick test that's not invasive. So I often get x-rays, and you're going to see some degenerative changes. Doesn't necessarily mean that that's the cause of your back pain, but it gives me some information to try and figure out what is the cause of your back pain. An MRI is typically not the first test we get. We get it if you fail conservative management, if we are concerned about any red flags, if conservative treatment hasn't helped, and maybe there's some other piece of information that we're looking for as to why you're still hurting, then we may order an MRI for back pain. Now, be aware that an MRI is going to show something. We accumulate imperfections as we age. Some people faster than others, but we accumulate these imperfections, these degenerative changes over time, and that doesn't necessarily mean it's the cause of your back pain. So a false positive is a finding on the MRI that isn't actually the cause of your symptoms. And so there are a lot of different ways to treat low back pain. And they go from, it's a spectrum of treatment. You go from less invasive treatment methods to more invasive treatment methods. And some of the less invasive ones, right? These are typically easier on the patient. There isn't a significant recovery period. It's not surgery. These are less invasive methods, and we always start with less invasive methods. If you go see a spine surgeon and for low back pain, and there's no obvious cause of the back pain, if they offer you surgery, I would run away. I very rarely ever offer surgery for back pain on a first visit unless there's something absolutely obvious that's causing your back pain. So we often start with conservative treatments, and that includes rest and activity modification. We know that most back pain goes away. One of my earlier slides, 90% plus of back pain goes away within 3 months. So why put you through a surgery that's going to take a year to recover from if you can be better with much simpler treatment options? So we always start with conservative management. Rest and activity modification. If it hurts to pick up something heavy, don't pick up something heavy. If your job requires you to do a repetitive activity that you know is causing back pain, maybe you try light duty for a period of time. Modify what you do. Topical treatments, ice and heat. I always counsel my patients. Ice and heat are cheap and they're easy and they can make you feel better. Heat relaxes the muscles. So when you have back pain because of tight muscles, muscle spasm, heat can feel incredibly good. And it can actually alleviate a lot of your symptoms, allow you to be more functional, allow you to participate in functional activity. Ice is an anti-inflammatory. You see baseball players icing their shoulders after they pitch in a baseball game, or ice on your knees after a basketball game. Ice is an anti-inflammatory. So when it's hurting and it's achy and it's painful, put ice on your back. It will feel better. It will decrease the inflammation and help alleviate some of your symptoms. There are some creams like Bengay, Icy Hot, capsaicin cream, Voltaren gel. All of those are different creams that you can topically apply to the low back to alleviate some of your symptoms. Lidocaine patches are an anesthetic, so it can numb your back and alleviate some of the pain. There are medications you can take. So non-steroidal anti-inflammatory drugs, or NSAIDs, are the mainstay for my practice. That includes ibuprofen, Motrin, Aleve, naproxen, meloxicam. There's a ton of them out there. And there's a variety of different formulations, different number of times you have to take it during the day. Some need a prescription, some don't. NSAIDs are anti-inflammatories. And since most back pain is caused by inflammation of the joints or the muscles, an anti-inflammatory can be incredibly helpful. So I often start you on an anti-inflammatory, or I ask if you're taking them, if you come to me with low back pain. Some patients cannot take NSAIDs. Patients on blood thinners, patients with kidney problems, patients with stomach ulcers. There is a population that can't take NSAIDs. So it is an important conversation to have with both whoever's seeing you for back pain as well as your primary care doctor. Ask them if it's okay, because it would be a good medication for you to take if you're allowed to. Tylenol is not an anti-inflammatory. It's a pain medication that works at the brain level, but it can help alleviate pain. You can take it with NSAIDs, so it's another option. There are nerve medications that we may prescribe, such as gabapentin or Lyrica. There are steroids. Oral steroids can be taken, or the steroid can be injected in the muscle so that it gets in your bloodstream and goes everywhere. Muscle relaxers can help alleviate some of your back pain, and pain meds, meaning like narcotic pain medications, can be useful in the short term, but you really need to see a professional pain management physician for a narcotic pain medication to be useful long term. I typically don't prescribe narcotic pain medications except in the acute setting, and it's very rare that I use narcotic pain medications for back pain. I really go towards the NSAIDs and everything else. If you come to me with back pain and you haven't done it yet, I'm going to send you to physical therapy. And you may say, Doc, the physical therapy, I can't move. I'm having so much back pain. How can I do physical therapy? The reason is that we need to train your muscles. We need to let your muscles heal. We need to make them more resistant to injury. We need to make sure that you are not compensating for your back pain and disrupting the normal function of the other muscles in your back. So I send you to physical therapy for flexibility, gait training, strengthening of your core musculature, so your abdominals, your back muscles, your butt muscles, and your hip muscles. All of those muscles attached to the spine and your pelvis, and they help to stabilize the spine. So I'm going to be sending you to physical therapy if you haven't done it before. And a home exercise program is equally important. I need you to get Arnold Schwarzenegger abs. You're not going to get that with 12 sessions of physical therapy. It really takes exercising at home and months of focused exercise on your core musculature to really make a difference and alleviate your back pain. There are different types of injections that we can try to alleviate your back pain. Steroids are typically used to decrease inflammation in the joints themselves of the spine. So pain specialists often will, under x-ray guidance, inject the steroid into the joints of the spine. And just like you get a hip injection or a knee injection, the steroid can alleviate some of the inflammation and alleviate your back pain. RFA, or radio frequency ablation, that's like it burns the nerves that go to the joints themselves. It's not the nerves that go down your leg. It's the tiny little nerve endings that go to the joints. And so the pain management physicians can perform this procedure to provide temporary relief for your back pain. It is temporary in that these little nerve endings are like weeds. They come back. And so it's a temporary treatment for back pain, but it can work. And so it's an option to discuss with a pain management physician because it's a procedure that often a lot of them do. And there are other pain management approaches. most patients with back pain don't need surgery. And so I try to get you to a pain management physician or a physical medicine and rehab physician, which is a non-surgical back doctor, and to try and figure out other ways that they can treat your pain. I'm very good at surgery. I am not an injection specialist. I haven't been trained in injections. So I use these other types of physicians and therapists to help treat your pain. So if you come to the Premier Health Spine Center, that doesn't mean you're going to see a spine surgeon. There may be a more appropriate physician that you may see first to try and help with your back pain. So it really is a team approach, and I send a significant number of patients who come see me to a pain management specialist. And that doesn't mean I'm sending you for narcotic pain medications. Oftentimes I'm sending you for injections, actually, or other treatment methods. Spine surgery really is a last resort. For back pain, you really need to find the source of the back pain. Because that's how we know what to fix with surgery. So spine surgery is typically a last resort, and it is often not appropriate for low back pain. The majority of the time, you should not have a spine surgery for low back pain. There are specific indications for surgery. So it's a last resort, especially in my clinic. If we can get you better without surgery, that's actually my goal. And that's coming from a spine surgeon. And we're going to we're going to try minimally invasive options if we can, but we're going to fix the problem. Another kind of gray area for treatments of back pain, these areas don't have as much science proving their effectiveness. I definitely have patients who benefit from chiropractics, benefit from acupuncture, benefit from massage. We just don't have a way of measuring their effectiveness. And so I can't really prescribe these modalities in a scientific way, but it doesn't mean it doesn't work. And I definitely have a lot of patients who improve with these other types of treatment methods. I'm almost done. I know we're going over time. I'm sorry about the delay, so I'll hurry as quick as we can so we can get to the questions. So how do you prevent back pain, right? Back pain, you have an 80% chance of having back pain at some point in your life. So ways that you can prevent back pain are, one, to maintain a healthy body weight. That puts less pressure on your joints, that wears things down slower. It puts less pressure on your muscles, so they have to work less. So maintain a healthy body weight. Keep your muscles strong. If you don't exercise, those muscles don't get challenged as much, and they're going to weaken, and that's a risk factor for back pain. So keep your core strong, not just your back muscles, but your abdominals, your butt muscles, your hip muscles, all of those. If you smoke, stop smoking. You're hurting yourself. So smoking has a direct correlation to low back pain. Maintain good posture and body mechanics. So this is, if you find yourself slouching at work, sitting at a desk, get yourself a standing desk. Force yourself to be in a better posture. Some people sit on those workout balls, the big giant rubber balls. That can kind of promote you to stand up straight, because if you don't, you fall off the ball. And then stay active, keep moving. If you live a sedentary lifestyle, you are at increased risk for back pain. That doesn't mean you need to go join a CrossFit gym and start lifting heavy weights. It means you need to be active, challenge your muscles in a safe and smart manner. And if you don't know how to do that, call the Premier Health Spine Center, because we will hook you up with information and guidance. I'm looking at this question and answer chat box. And the first question is, can hip issues cause low back pain, including nerve pain in the buttock and thighs? The answer is absolutely. The hip is very close to the spine. If you have hip joint problems, you can get pain in your groin, you can get pain in your buttocks, you can get pain on the outside of the hip, or what we call the lateral side of your hip. There's a close relationship between hip pain and back pain. And you can have both. You can have a bad hip, you're limping, you're less mobile, and then your back stiffens up and you start getting back pain. So sometimes treating the hip can alleviate the back pain. So that's part of the diagnosis and workup for back and hip pain. The hip joint will not send pain down to your foot. That is a nerve pain. That is either a pinched nerve in your back or in your butt. It's not from the hip joint itself. So if you have pain shooting down your leg, I'm leaning more towards a cause of pain being in your back. Another question is, what are your feelings about hydrotherapy or pool therapy? I love it. The pool takes gravity out of the equation. It takes your body weight out. If you get into water deep enough to your chest, the amount of weight that your joints feel is significantly decreased. So I will send a lot of patients to aquatherapy. If they say, "Doc, I can't even walk because it hurts so much," why don't we try you walking in a pool? That's going to take gravity out of the situation. It's going to take the weight off your joints. So it also gives a little resistance. So it can be a cardiovascular exercise. So I love aquatherapy. If you can't swim, I would say get some floaties on your arms and get in the pool, because you can benefit tremendously from it. Another comment, any comment on upper back or neck issues, symptoms of neck clicking and grinding? Yes, if you have arthritis in your low back, you probably have arthritis in your neck or other joints in your spine. The clicking and grinding in your neck can be from those uneven, the non-smooth surfaces of the joints from arthritis rubbing together and causing clicking. Clicking in itself is not necessarily pathologic. It's when it's associated with pain that it becomes an issue. What about TENS units or electrical stimulation? Those work by confusing the spinal cord. Basically, the pain fibers going to your spinal cord are also transmitting these electrical signals from the TENS unit, and it confuses your spine. And so you don't feel the pain as much. So a TENS unit can definitely improve your back pain. It's safe. And you can get them offline or use them when you're at physical therapy. So a TENS unit is definitely an option. Another question, where in the area is hydrotherapy available? If you have access to a pool, you have access to hydrotherapy. You can walk in any body of water that you can safely walk in, right? And you want the water deep enough to get to the level of your chest. So if you have a pool in your backyard, you can walk in a pool. If you have a YMCA available, you can walk in that pool. If you want to work with a therapist, we have to prescribe aquatherapy. And Premier Health has aquatic facilities or physical therapy facilities with a pool available at multiple locations. So when I order physical therapy for you and the therapy department calls you and asks where you want to go, tell them you want to go somewhere where there's a pool. And we have them, I'm at up north a lot. We have facilities up north. If you come see me at Upper Valley Medical Center or Miami Valley Hospital North, I know they have pool facilities nearby with the therapist to work with you. So just it's an option for anyone. If you want to do it with a therapist, there are options, and Premier Health will get you hooked up. Another question is, my father was diagnosed with ankylosing spondylitis. Is it hereditary? Yes. That doesn't mean that if your father has it, you will have it. There is there's a gene that is associated with it. And if you have that gene, you are at an increased risk for ankylosing spondylitis. It's called HLA-B27. If you're concerned about it, you can get tested for it. That's a question to have with your primary care physician on whether or not they think testing is necessary. If you're not showing symptoms, it may not be worth testing about it, or if it's causing you significant anxiety, and getting the test done is going to relieve that anxiety, then it may be worth doing. Another question: what advice would you give to a nearly 70-year-old low-weight female with moderately severe scoliosis with nearly daily back pain? I take calcium with vitamin D and my bone density is decent. I applaud you for being so mindful of your bone density. There are so many older patients out there that don't pay attention to it, and I end up seeing them because they got a compression fracture. First of all, I applaud you for monitoring your bone density. Scoliosis is a condition that we often treat without surgery. So having strong spinal musculature can help prevent pain or diminish pain in patients with scoliosis. If you're tilted off to the side because your spine, this side of your spine is going to be working hard, right, to keep you from falling over. So if you can make your muscles stronger, more able to cope with your deformity, then that's the best thing that you can do. Maintain strong musculature. Another question. Let's see. What options are available today for the loss of cushion between the spine vertebrae? So the loss of cushion refers to osteoarthritis. It's wear and tear of the discs in between the bones. It's a degenerative process. It's wear and tear. So if you lived in space where there was no gravity, your disc spaces would look great. But unfortunately, we all live on Earth, and we're also subjected to degeneration to some degree of the discs. And so things that you can do to prevent disc degeneration is maintain a healthy body weight, maintain strong muscular support of your lumbar spine, and avoid high impact activities that put you at risk. Once the disc starts to degenerate, all of that still applies because you're still trying to slow down the degeneration. And then if we're talking about treating a degenerated disc, then there are different options. There's a lot of research being done on stem cells. The research by no means is conclusive on whether stem cells work. We don't know how to get the stem cells appropriately yet. We don't know how to get them into the spine. We don't know how much we need. So there's still a lot of research to be done on stem cells, but it's on the horizon. Another comment: if you are in your early 80s and you have shrunk approximately 2 inches, could this cause lower back pain? I am a woman. So the reason you lose height is the discs degenerate. So the disc spaces lose height. That will contribute to loss of height. You'll see older patients develop a hunching of their back sometimes. That's called kyphosis. That can be due to the degeneration of the discs. It can be due to wedging of the vertebrae. It can be due to more acute things like compression fractures. So the shrinking is a sign of degeneration of the spine. And so that can certainly cause low back pain. Even just the hunched over thoracic spine can cause lower back pain because it alters the mechanics in your spine. What are your thoughts about having surgery to remove the arthritis? Arthritis cannot be removed. If you have knee arthritis, you can get a knee replacement. They can't replace the cartilage that is lost. So we can't remove arthritis. It can be replaced, it can be removed and replaced, but you can't just take away arthritis. And in the spine, we can't replace your spine. We can replace individual discs if that is the only part that's degenerated, but we can't remove arthritis from the spine. It really becomes an issue of managing arthritis in the spine. We do fusions where we take away motion of the segments of the spine that are causing pain, but it's not really removing the arthritis. But fusion can be a treatment option in the appropriate indications. Another one, let's see. I'm considering what I assume is the Vertiflex procedure, although I'm not sure if this is not spelled right, after many other procedures that did not work. I'm an injured fireman who fell through a floor, 86 years old, and the injury was back in 1975. I'm not too familiar with the Vertiflex procedure. If it is what I think it is, there are some back pain procedures where they burn the nerves within the vertebral body. It is not burning the nerves in the joints in the back of the spine. That's called a radiofrequency ablation. There is a procedure out there that burns the nerves in the vertebral body. The research is not robust. You have to be the perfect candidate for it. So that often takes a long time of trial and error with treatments and diagnostic tests. You really have to be the perfect patient for it to work. So I don't do that procedure. I'm not familiar. It's a pretty new procedure. I don't know who does it in the area. I would go online and Google it and see if there's anyone who can talk to you about it more than I can. But it is a procedure that I've heard about. So you should be able to find some information. All the questions are gone. So I assume we got through all the questions or the questions that we had time for. So I appreciate you guys being patient. I know we went over time. I enjoyed talking to you guys. If you have any issues that need clarification, you want to ask more questions, you want to be evaluated, go on to the Premier Health website. There's the premierhealth.com/Premier Health Spine. We can hook you up with the right provider, with information and someone to talk to. So my contact information is on the website. You can get a hold of me through the office. That's the easiest way. I'm a busy spine surgeon. I'm in the OR all the time. So you may talk to my nurse practitioner first. They will Robert Rogers is my nurse practitioner who works closely with me. He will often evaluate patients before they ever get to me. He may order MRIs or additional tests as needed. So we do have non-surgical providers who may be the first line that you see. And that's perfectly acceptable. Spine surgery is very complex and not for everyone. So get on the website, premierhealth.com/Premier Health Spine, and we will get you to where you need to be, and we'll get you the answers that you're looking for.